Hi, I'm Dr. Yao, and today I'm just going to quickly talk about asthma. So asthma is a common lung condition which causes breathing difficulties, and this is due to the inflammation of the airways and the narrowing of the airways, which causes the breathing difficulties. The exact cause of asthma is not known, but we know there are certain triggers, for example, infection, exercise, weather, and sometimes it's worse in the morning and in the evenings as well. The treatment for asthma is normally split into inhalers or tablets. There are different types of inhalers, such as the reliever inhalers or the blue inhaler, and the preventer inhalers, which are the brown inhalers, and sometimes purple or red inhalers. And sometimes if your asthma is not well controlled with the inhalers, we normally add on a tablet as well. Things that you can do with your asthma and to help improve your asthma is to make sure that you are taking your inhalers correctly and regularly, doing plenty of exercise. Once your inhaler regime is well up to speed, you shouldn't have any symptoms of asthma when you're exercising, and also to make sure you get your regular asthma reviews done yearly. It is also important to get your vaccinations done once a year for the flu vaccination, for example. The things that you can look out for in terms of asthma, especially what we call asthma attacks, is that you get the severe symptoms of breathlessness, tightness in the chest, and wheezing, and sometimes cough as well. So if you were to experience really severe symptoms, what you should do is sit up, take a nice deep breath, stay calm, and take one puff of your blue inhaler every 30 to 60 seconds for up to 10 times. And after 10 puffs of your blue inhaler and you're still feeling breathless, please call 999. And if the ambulance is taking more than 15 minutes to arrive, you can repeat taking one puff of the blue inhaler every 30 to 60 seconds. So in summary, asthma is a very common condition. It is well treated with inhalers and sometimes tablets, but please make sure you have your regular reviews, avoid certain triggers that can cause it if you know those triggers, and to make sure you stay up to date with your vaccinations.
Hello, I'm Dr. Deer, and today I'm going to talk about coronary heart disease. So the heart is a very important muscle in the body, so it pumps blood all around our body, but it gets its own blood supply from something called the coronary arteries. So coronary heart disease occurs when one or more of these arteries are narrowed or blocked. Usually that occurs because of a build-up of material, and sometimes it can be caused by a spasm. Some of the symptoms you can experience when you've got coronary heart disease include pain on exertion. So if you're walking or exercising, you might be experiencing pain at the front of the chest. Sometimes it can go up to the jaw, the neck, or even the arms. And sometimes you feel a real heaviness or tightness in the chest. If you're experiencing anything like this, always seek medical attention. Now, there are some things you can do to help prevent coronary heart disease yourself. That includes making sure you have a healthy, balanced diet. If you do smoke, then consider quitting. Make sure you don't drink alcohol in excess, more than the recommended limits. Make sure you do a moderate amount of exercise regularly, and make sure that if you've got high blood pressure or high cholesterol, that these are well controlled. So in summary, if you're experiencing chest pain on exertion, it may be a sign of coronary heart disease, but there are many things you can do to try and prevent and treat coronary heart disease, including leading a healthy lifestyle, making sure you're eating healthy and avoiding smoking and reducing alcohol. Thank you very much today for watching the video, and I hope you enjoyed it, and I hope you'll stay tuned on our channel for more.
Back pain feels very awful. It limits your ability to function. All in all, it can be a nuisance, but it's something that can be fixed. One important measure is to ensure you are sitting correctly, especially if you work a lot on a desk. There's a lot of resources out there with regards to exercises, and if there's any concern, always please contact us at HIAS. One of the most common causes of back pain is abnormal posturing. It could be if you're sat at work or when you're trying to pick up items from the floor. Other common causes of back pain are if you strain the muscle, i.e. if you're doing some kind of exercises. Less common causes of back pain are things like sciatica, if you've got problems in the spine, like ankylosing spondylitis, or if you've got some form of bony or blood type of cancer. The top tip to remember about back pains really is to look out for the red flags. Something you need to be aware of. Issues like if you're not able to control your waterworks or your bowels, or you find that when you wipe after using the toilet you can't feel yourself wiping. In clinical settings we call that perianal numbness. It's important you seek urgent medical advice. Another top tip is ensure you are sat correctly when you're working, on a desk or at a desk, sorry. And if you've got any concerns, there's a lot of resources out there, and also please do speak to your GP if you have any worries or concerns.
Can you show us some back exercises?
Unfortunately, I have exercises.
Thank you.
Hi, I'm Dr. Yale, and today I'm going to talk about COPD. COPD is a common lung condition which tends to affect middle-aged or older adults, and it causes breathing difficulties. Commonly, it causes a lot of wheezing, coughing, and recurrent chest infections. The cause of COPD, in 9 out of 10 cases, is related to smoking. In treatment for COPD, it's normally making sure that you are on inhalers to help with your breathing. And this can be in different types of forms of inhalers, such as the powder or the aerosols, but what they do is try to help maintain your day-to-day activities. We know that COPD can have an effect as it goes on, and sometimes it may be worsened with time. So there are some good things to do in order to prevent further damage to the lungs from COPD. For example, one of the best things you can do to help prevent worsening of your COPD is actually to stop smoking, just to prevent further damage to the lungs from the smoke being inhaled. Other things that you can do to help improve your COPD is to make sure you maintain your healthy weight, because we know carrying extra weight does actually increase the burden to your work of breathing. The other things that can be helpful in COPD is also maintain regular exercise. We know that doing exercises to the point where you're slightly short of breath is actually safe, and it's good to maintain some capacity with regards to exercise and your breathing. There are some simple things that you can do as well to ensure that your COPD is kept in check, and that is to make sure that you have your COPD reviews regularly every year, to make sure that you take your vaccinations yearly, for example the flu vaccination or the pneumococcal vaccination as a one-off, and if you still smoke, to stop smoking.
Thank you for coming to Cumberland Lodge today. It's been a nice time, and it's been nice to get to spend more quality time with everyone. I know the last couple of years have been difficult, so it's been good to get together and create videos and content. Thank you.